Today I'm going to talk about the best treatments for low back pain. Obviously, surgery should be the last treatment for low back pain, but there are many things that can be done to help your low back function, heal, and in general feel better on a day-to-day basis. Hi, I'm Dr. Paul Lieber from Regenexx Pittsburgh. The first thing to think about as it relates to your low back pain is your exercise regimen. If you're going to exercise, what kinds of exercise can you do to help your low back? And we'll talk some more about walking later, but walking is a very important exercise as it relates to your lumbar spine. Things like thinking about your bed and how recently you've changed your bed and how comfortable you are at night. That certainly can play a role in your low back pain as well. Thinking about exercises, as we started to talk about, there are exercises that are good to do for injuries to your lumbar discs, and there are exercises that are different and good for you to treat lumbar spinal stenosis, which is a condition which is related to getting older and your spinal canal getting narrower. So let's start with the older first, since I'm an old doctor, and spinal stenosis is something that I think about. Spinal stenosis, by the way, is when your spinal canal gets crowded by your discs, your ligaments, your facet joints, and as a result, you get some nerve pain, possibly some weakness in your legs. And the exercises to do for that condition are flexion exercises. What does that mean? Bringing your single knee to your chest and holding it for 60 seconds, repeating it once, doing both knees, bringing them to your chest and repeating it once after you've held it for 60 seconds. And also doing what's called a passive hamstring stretch or straight leg raising maneuver, where you're putting a jump rope or strap under your foot and using your arms to pull your leg up without bending your knee to the point where you can tolerate it, and leave it there for about 60 seconds and repeat that. And those are the hallmarks of treatment for lumbar spinal stenosis, and they make a big difference in opening the spinal canal. For more advanced treatment as it relates to lumbar spinal stenosis, we send people to physical therapy and they do more advanced work. For people who have disc pain or disc pain with sciatica, the treatment's typically different, and this is where we talk about core stabilization exercises and extension exercises, arching your back backwards and strengthening your abdominal muscles and your back paraspinal muscles to tighten your spinal segment and help with that protruding disc and that sciatica. There are passive treatments for disc herniations, which you can get in physical therapy, sometimes in chiropractic, where they'll do what's called spinal traction, where they put you on the rack and stretch you. And in so doing, they distract the disc, and that can be helpful. People do the same thing with inversion tables, where they go upside down, and that provides some distraction for your lumbar disc and can be helpful in sciatica. Just like the passive straight leg raise for spinal stenosis, passive straight leg raising for sciatica from a disc protrusion in the lumbar spine can be very helpful as well. Can do what is referred to as neural flossing, where you're moving your nerve at the spinal segment region to free it up so that it no longer is pinched. When the nerve is pinched, it can swell, and therefore it's like a wetting band when you've drunk a salty liquid and you can't get your wedding band off. The same is true when your nerve gets caught in that neuroforamen, which is the hole the nerve exits out of to the side of the spine. And by doing neural flossing or straight leg raising passively, you can free that nerve up. So those are some exercises that can be done. Again, walking is a great exercise, different than running, which is not a great exercise for your spine because it compresses your spine when you're pressing on your legs aggressively during a running activity. Bicycling can help some people with their spine. It's a double-edged sword because people who have spinal stenosis, for instance, can bend forward and open their spinal canal. So exercising on a bicycle and opening the spinal canal by bending forward can be helpful. But at the same token, if you have a disc injury, bending forward can be problematic because it increases the pressure on your disc and possibly increases the pressure on your nerves as well. The literature related to disc herniations and MRIs, everybody wants to get an MRI, but we clinicians think that it's important to see the patient and try to figure out what's wrong with them before getting an MRI. And the reason being is an MRI shows a picture, and the picture is not necessarily the clinical presentation. So 33% of people have asymptomatic disc herniations on MRI. So therefore, just getting an MRI can be very misleading and not be very helpful. Anyhow, we know that over 90% of people with lumbar herniated discs that are symptomatic don't require lumbar spine surgery, and they may go to a surgeon first, and the surgeon may recommend surgery, but that's not necessarily what's needed. Over the course of time, discs do naturally reabsorb and pressure is taken off the nerves. Traditional treatment as it relates to spine care can put a Band-Aid on an injury to the disc causing sciatica, whereby injecting a steroid can reduce the inflammation temporarily. But I tell my patients, you may win the battle, but you haven't necessarily won the war. The war basically is that a disc, like a jelly-filled donut, has jelly on the inside and is firm, fibrous on the outside. If the jelly squirts out, that firm disc that was firm becomes like a deflated pillow, and that spinal segment between the vertebral bodies and the disc becomes sloppy. And so by treating the problem traditionally with steroid, you may reduce the inflammation on the nerve temporarily, but you're not solving the problem, getting the person better. This is assuming, of course, that the exercises and the ibuprofen and all of the other muscle relaxants, things like that, have been ineffective in treating the patient, because oftentimes people will get better on their own without needing a specialist. But when you do need a specialist, we at Regenexx Pittsburgh treat the spine differently. We treat the spine using your blood platelets and using platelet lysate to heal tissue, nerves, and discs in a comprehensive, concerted way, where we'll inject ligaments, we'll inject facet joints, which are the two joints in the back of the spine that can act up. We can inject joints and we can inject nerves. And in so doing, we can solve the spinal segment problem and give somebody a long-term pain relief. And it really doesn't matter whether it's spinal stenosis or a herniated disc with sciatica or a sprained ligament. The treatment is similar in treating the segment comprehensively and in a concerted manner. And this does involve several different injections, not one injection. Usually it can be done over the course of 45 minutes or so. We do use image guidance, primarily what's called a fluoroscope, which is an X-ray machine which tilts in space and gives us the views that we need. And we often will use contrast dye to confirm that the structure that we're injecting is accurately depicted on the fluoroscope. We can also use ultrasound to treat deep ligaments, and this is especially helpful for the deeper ligaments in the sacroiliac joint region. We can also treat muscles. The deepest muscle is called the multifidus muscle. It's those long muscles in the back of your spine. And sometimes when your spinal segment isn't working properly, those muscles seem to become smaller and atrophied, and we can inject them with growth factor and bring them back to functioning. So these are some of the ways that we wind up treating the lumbar spine. So I wanted to talk to you about things that you should avoid if you have low back pain, because it's important to avoid certain things like repetitive bending, like prolonged sitting, like lifting heavy objects. Lifting heavy objects out of the trunk of your car, for instance, can put undue stress on your low back and make it worse, particularly if you have a disc herniation. These are things that should be avoided if you have a history of low back pain, particularly if you have a disc injury, because it can worsen your condition. Other things that I try to work with my patients on, because a lot of patients are gung-ho to get back to lifting weights or doing activities that can be very hard on your low back. I'm very much somebody who recommends gradually easing into a strengthening program, because that can put undue stress on your low back. And it really doesn't matter whether you've had traditional treatment or regenerative treatment. You want to go easy on your lumbar spine for a period of time before you are able to exercise to the fullest once again. So there are damaging effects of oral or injectable steroids, which can have significant consequences on your general health. The most important one is that steroids can cause bony demineralization, leading to osteopenia or osteoporosis. That's thinning of your bones, or as I tell patients, if they've had a lot of steroid injections, they can turn your bones to mush. And this doesn't happen immediately. It's a long-term effect of the steroids. Likewise, there can be an extreme effect where the hips or shoulders lose their blood supply as a result of repetitive steroid use. And that leads to joint replacement, because the blood supply to the hips or shoulders is gone after that, and the hip bones and the shoulder bones start to die. Other bad effects are that it affects diabetics. The steroids affect diabetics and up your blood sugars. And there are occasions when people who are non-diabetic cross that line and become diabetic as a result of a steroid injection. They can change your hormonal axis so that, for instance, people who are postmenopausal can start menstruating once again, or are premenopausal and can stop menstruating. So there are lots of bad effects associated with steroid use. So we talked some about walking and how it was helpful, but I did not go into depth talking about walking. But walking can be extremely helpful in treating low back pain, and it's a cornerstone of many of the rehabilitation efforts provided through physical therapy. Walking is a great thing to do if you have spinal problems for a number of different reasons. So I'm finishing with this video. I will be talking about walking and how it will help low back pain in the next video. Please tune in to that video.